Good morning, Namaste, Pranam to all brothers and sisters. I am Dr. Divagaran, Cochin. My subject is Medical Science and Astrology. Today I am going to speak about the diseases of stomach and duodenum. This term refers to an occur in the lower esophagus, stomach or duodenum, which may be acute or chronic. Patients with peptic ulcer often have a family history of the disease. This is particularly the case with duodenal ulcers, which develop before the age of 20. Till 1983, it was thought that ulcers occur chiefly due to the increased secretion of the acid and also due to stress and alcohol intake. There is, however, a total change in the concept now. In 1983, a bacteria called Helicobacter pylori was developed in the human stomach. Doctors reckon that it is responsible for peptic ulcer and its gradation can control ulcers. Surgery for such ulcers has reduced dramatically. The bacteria is carcinogenic and cause cancer of the stomach. The ulcer could occur at any age and 50% of the population is infected with this bacteria. The mode of spread of this bacteria is not known, but the volume of information on the subject is increasing. The symptoms of ulcers are upper abdominal pain and vomiting. The three notable features of ulcer pain are localization to the epigastrium, relationship to food, and periodically. It may occur regularly for days or for weeks at a time, then disappear to recur weeks or months later. As the condition becomes severe, the pain lasts longer and occurs more frequently. Vomiting is ulcer patients almost always relieves pain, and when it is persistent may result in the weight loss. Duodenal ulcers pain tends to occur between meal times and the patient describes its hunger pain and which is relieved by food intake. It is important that aspirin and other anti-inflammatory drugs are not used in peptic ulcers. A patient must stop smoking and consuming alcohol. Relatively rare diseases of the gastrointestinal system, which includes benign stricture of the gallus, esophageal, various totonins, prominent veins in the gullet associated with the cirrhosis of the liver, common among alcohols chronic gastritis, acute and chronic pancreatitis, which is an inflammation of the pancreas due to excessive alcohol or stone in the pancreatic duct, TB of the small intestine, and various forms of colitis, namely ulcerative colitis, mucus and colitis, irritable bowel syndrome, piles, fistula and etc. According to astrology, the stomach has been ascends to the 5th house and Simha Rashi. Such is Karaka for the same. Affliction of the 5th house, Lord of the 5th house, Simha Rashi, and the Sun gives rise to the diseases and troubles concerning stomach. Further, 5th house rules the right side of the stomach along with Simha Rashi, while 9th house and Dhanush Rashi rules the left side of the same. Saturn and Ketu causes all stomach pains. Saturn produces all diseases from irregular and bad eating, while Ketu produces all diseases from hunger and insufficient eating. The disease of the 5th house, that is, stomach, is mostly interlinked with diseases connecting bowels, which is governed by the 6th house and Kanya Rashi. We shall now discuss many diseases concerned with the 5th and 6th house. Spleen is situated in the left side of stomach. 9th house and Dhanu Rashi governs the same. Jupiter is the Karaka for spleen. Simha Rashi, 5th house of the natural zodiac, has also its ruling. Murda Asya Gala Skanda Hridaya Udara Vasti Desha Guhyani Kalangani Varangam Anana Muruhral Krodavaso Vasti Venjanai. Similarly, according to Kalapurusha, കാലപുരുഷന്റെ വയറെന്ന് പറയുന്നത് കന്നിരാശിയാണ്. അതുപോലെ തന്നെ ചിങ്ങൻ രാശിയും ഈ ഭാഗങ്ങളാണ് ഭരിക്കുന്നത്. സ്പ്ലീൻ ഡിസീസസ് മേ ബി ഓഫ് മെനി കൈൻഡ്സ് സച്ച് ആസ് rupture of spleen, tuberculosis of spleen, abscess, tumor, etc. To produce tuberculosis of spleen, affliction of association of Rahu with the house and plants ruling same and malefic influences over the same are necessary. To produce tumor, abscess or rupture, affliction of Mars in similar way is necessary. Mars is the ruler of operation. In some cases, as the operation must be done. If a doctor suggests for operation, don't take Amavasya and Paurnami days. The Amavasya and Paurnami days, the water tides will be rises. Our body has 70% of water. So the water level will be increases and the blood, so the circulation of blood will be more. So don't take the dates of Amavasya and Paurnami. You please suggest that the Ashtami, Navami Tidhis are very, very good for operation. The Tidhi is also very important. Tidho Shubhayam Shubhatenugule Tare. Thank you very much. If you like my subject, please subscribe it and the bell button switch on. I'll come tomorrow with the other subject.